All right, let's jump right into it. Today, we're going to pull back the curtain on something that affects millions of people but is, still so misunderstood: dyslexia. Our whole goal here is to give you a really clear, science backed look at everything, from the very first signs all the way to solutions that we know actually work. It sounds so simple, right? But that little moment of hesitation, that pause, well, that's an experience that a lot of people with dyslexia know really, really well. It's just one of a whole cluster of little things that can point toward this very common learning difference. So just have a look at some of these common signs. Do any of them ring a bell? That feeling of reading really slowly, or having to go back over paragraphs again and again just to get what they mean. Or maybe it's mixing up words that look almost the same, like cat and cot. Or, your thoughts just feel like a total jumble when you try to write them down. It can even show up in things like struggling to keep yourself organized or manage your time. The key is a person with dyslexia usually has a few of these things going on, and they don't just go away. And this is so important. For decades, people got this completely wrong, but the science is crystal clear. Dyslexia has absolutely nothing to do with how smart you are or how hard you're trying. It's all about how the brain is wired. So let's get to the heart of it. If it's not about intelligence, what is it? What is actually happening in the brain? Well, to understand that, we need to look at the official scientific definition. And here it is. This is the big aha moments, right? From the International Dyslexia Association. The key phrase here is neurological in origin. That just means it's brain-based. It's not a choice. It's not a personality flaw. It's a brain-based difference that mostly messes with your ability to recognize words easily and spell correctly. So let's just break that down into the key things to remember. First off, it's brain-based, and it often runs in families. Second, and this is the absolute core of the issue, it's a difficulty with the phonological component of language. That's a fancy way of saying it's about processing the sounds in words. Now, this next point is huge. It is not a vision problem. The whole idea of seeing letters backward is pretty much a myth. And finally, it's considered unexpected because you often see it in really bright, articulate people who are amazing at other things. And this is a perfect way to picture that unexpected quality. An individual with dyslexia can listen to a super complex story and totally get it. Their listening comprehension is great. But when they have to read that exact same information, the struggle to just get the words off the page acts like a roadblock, and their reading comprehension takes a hit. So noticing the signs is step one. But the next step is getting some clarity. How do you go from just having a hunch to getting a formal diagnosis that can actually open up the doors to getting real support? The answer is a formal diagnostic assessment. It's really the only way to know for sure if it's dyslexia, and it's a pretty detailed and comprehensive process. Yeah, a proper evaluation isn't just some quick online quiz. It's a deep dive. It starts with background info, family history, school history. Then it looks at oral language skills. But crucially, it tests things like word recognition, decoding new words, and that core skill we talked about, phonological processing, the ability to work with the sounds of language, and of course, spelling. It's a very thorough investigation. And the whole point isn't just to get a label. A really good evaluation identifies specific strengths and weaknesses. It pinpoints exactly where the process is breaking down and basically creates a personalized roadmap for what kind of help is needed. Which brings us to the most important part of this whole thing, the solution. I mean, a diagnosis is only as good as the help that comes after it. And for dyslexia, there is a very clear evidence-based approach that really, truly works. It's called structured literacy. This is the gold standard, you guys. It's not about just trying harder or using gimmicks like colored overlays on the page. It's a specific approach that directly teaches the structure of language in a way that just makes sense to the dyslexic brain. So what makes it so effective? Well, first, it's systematic and cumulative. Think of it like building with Legos. You start with the simplest blocks and build up logically. No gaps are left behind. Second, it's explicit. This means the teacher doesn't just hope the student gets it. They directly explain and model every single concept. And finally, it's diagnostic. The teaching is constantly being adjusted based on how the student is doing. I absolutely love this quote. It just perfectly makes the point that it's not about buying expensive programs or fancy gadgets. The most important thing is a knowledgeable teacher who is using the right method. That is what unlocks reading for a child with dyslexia. And support from home is huge. While a child is getting that specialized instruction, simple things like reading aloud to them every day, it keeps building their vocabulary, their understanding of stories, and maybe most importantly, it keeps that love for stories alive. So, when you get the right teaching and the right support systems in place, the whole focus can shift from struggle to success. And this isn't just about surviving school, it's about actually thriving in life. The IDA Handbook has some fantastic advice for families. The absolute key is to become an advocate. Keep your expectations high. These kids are smart. Also, help them find an area of expertise, something they're passionate about, to build up their confidence. And, so important, talk openly about their learning differences and try to keep a sense of humor about it all. It makes a world of difference. Honestly, the outcome of this whole journey can be so positive. With the right tools and the skills to speak up for themselves, students with dyslexia go on to successfully navigate college and build incredible careers, often using the unique strengths that come with their different way of thinking. So when it all comes down to it, what we've seen is that dyslexia isn't a deficit to be cured, but a difference to be understood and supported. And that leaves us with a bigger, more important question. Instead of asking how to fix people, maybe we should be asking, how can we design our schools and our workplaces to truly value and unlock the potential of every kind